Oftentimes, many people have complained how a particular method or different kinds of child spacing methods have become inefficient or failed or resulted in unplanned pregnancy. Well, according to research, this inefficiency or these failed reports are caused by human errors. Today on Contraceptive Matters with DKT Nigeria, we are looking at the following or different types of causes or reasons that make a child spacing method inefficient. I am Olasumbo Muduke. Please stay with us. The program continues shortly. All right, thanks for staying with us. It's still Contraceptive Matters with DKT Nigeria, and this program is made possible by DKT Nigeria, of course, one of the largest and private providers of contraceptives and reproductive health products in the country. And basically what we do on this show is to encourage women and sexually active persons, families out there to embrace healthy, informed and smart choices when it comes to reproductive health issues, healthy lifestyle, smart choices when it comes to child spacing method. Thereby, we try to advocate reduction in maternal mortality rate, reduction in sexually transmitted diseases as well. And today, we are looking at something different from what we've been discussing, because in the course of the program, in the past episodes, we've had callers, we've had our viewers complained about particular failed method or different types of reasons. They come up with different types of reasons about the inefficiency of any method adopted by them. And today we are looking at how to curtail or how to end the regular complaints by our viewers out there. And I'm not alone in the studio, and I have with me Dr. Tosin Laleye, a regular medical practitioner.
Good afternoon. It's
How
good
are
to be
you?
back in the studio.
All
Very well.
right.
Thank you.
Okay, we've had a number of people call or send messages to DKT's toll-free short code about failed method. And along the line, according to a research, these methods or this complaint are caused by human errors, common human errors
Most
that
of
we
the
overlook.
Yes.
So can you please share some of them with us?
Okay. Thank you very much. I'm going to try to just tell us some of the reasons why contraceptives tend to fail. I also would like to start by saying that the reasons are not limited to the things I'm going to discuss here today. Yeah, so I may not be able to say everything, but the commonest ones that we have available, I'll try and touch on them. So for starters, I would like to talk about not paying attention to details, not paying attention to the instructions attached with these contraceptive methods. And the major contraceptive method here is the daily pill. You know, each time we talk about the daily pill, we try to make our viewers understand the importance of taking this pill around the same time every day, such that you don't take the pill in the morning today, and then tomorrow you take it at night, the day after you take it in the afternoon. No, no, no. For maximum effectivity, for maximum efficacy, if you want it to work the way it should, you need to try and take it around the same time every day. And that's why we advise that you could set an alarm on your phone or just put up reminders here and there that would remind you to take this drug around the same time every day, such that you are assured of its maximum effectivity. You don't need to worry about whether or not it fails. So for some people on this method, the reason why they may record an unwanted pregnancy while on the method is if they don't take it around the same time every day, or if they forget. Usually we say that, okay, if you forget to take your pill today, then if you remember tomorrow, just take the 2 pills at a time. At a time. Yes, we usually say that. But by the time you are forgetting to take the pill for 3 days...
Sorry to cut you. Okay. Is it once a day?
Yes, definitely. The daily pill is just 1 tablet a day. So, and that's why we say you try to take it around the same time. If you want to take it 7 p.m. in the evening, try to make sure that you stick with that time. Always take it at that time. And then another contraceptive method in this category is the post pill. That's the emergency pill. Now, we usually say that you try to take it as soon as possible after unprotected intercourse, if you know you are not yet ready to get pregnant. So you've had unprotected intercourse, don't wait 2, 3, 4 days before you take the post pill. Even though we say it can still work for up to 5 days, it is advised you take it as soon, for maximum effectivity, you take it as soon as possible. So if you can, for these 2 methods I've mentioned, if you can pay attention to these things I've said, you are not likely to record any failure from them. But like we say, no method is 100%. But at least for most of the methods, we achieve over 90%. Some as high as 99.9%. So you can be rest assured if you use it appropriately. And then another reason why some contraceptive methods may fail is malhandling. If you do not handle it very well, you may not get the desired result. And the one that falls under this category most of the time is the condom. Sometimes condoms are not handled properly. For example, starting from the storage, you have it on the pack most of the times for most other medications. So we'll say store in a cool, dry place. You know the condom,
Do we actually observe that
a lot of us don't,
despite our weather condition?
But at least you can find a cool place in the house to store it. And you know that the condom is made from latex, it's rubber. So if you put rubber in a place that is too warm, you can have it
we have some guys who keep it in the wallet,
at the back pocket, as they're getting on bikes, getting onto buses, they keep sitting on it and all of that. That is really not good for the condom. And then when you're trying to put it on also, especially in the case where you have the female partner assisting the male in putting it on, You find out women who have nails fixed, some wear rings that have sharp parts on them. You need to pay attention to these things. So as much as possible, when handling the condom, you can take off your rings. If you have sharp nails on, maybe you allow your male partner to put it on himself. And also the way you put it on matters. It is part of the instructions. You're usually supposed to put on a male condom on an erect penis. So if there is no erection yet and you try to put it on, you're not going to get, you won't put it on properly, and it may end up being removed and it may just slip off. Yeah. And then the way you put it and the way you also remove it matters. So you need to pay attention to these little details, seemingly little details, but they go a long way to you achieving your desired purpose with these methods. And then another reason why a contraceptive method may fail is if you ignore your doctor's appointments. For example, if you are on the intrauterine device, you know, we say it is inserted by an expert, a medical expert. Usually when this intrauterine device, which is the IUD for short, when it is inserted, the woman is actually given follow-up dates. Okay, come back on so date for us to check it to make sure it's still in place. So if you are the kind of woman who doesn't pay attention to that, if you ignore that visit to the doctor, the intrauterine device may have been displaced and you may not know. So if you end up getting pregnant, you may just say, oh, this method wasn't effective and all that. But it is not that the method was not effective. You did not go to get it checked out when you were supposed to.
Okay, so before we move to another reason, something just came up into my mind now. What if, to start with, before you even start complaining about an error, do I need to, I don't even need to say do I need to, I must get the right method for me.
Definitely.
To start
Definitely,
with.
yes.
You cannot just say, okay, you want to adopt any method.
No.
That's the rule number one.
Rule number one. Well, except for maybe the over-the-counter contraceptives, which are just the condom and the emergency pill. The emergency pill is not a permanent method, it's just a one-off thing. We usually advise that you walk into any family planning clinic around, have a discussion with your health professionals, because even with the condom you can buy over the counter, some people react to latex or rubber. So by seeing a health professional, you get into discussion with them, they will be able to guide you. Note my word, they only guide. Your healthcare professional does not choose a method for you. Nobody forces any method on you. Okay. They will only tell you about the different methods, take the necessary medical history from you. Well, the only test that is usually recommended is pregnancy test. Before you can adopt any method, they need to rule out pregnancy. Okay. So really, the only test that is done is a pregnancy test to rule out pregnancy, and then they tell you the advantages and disadvantages of the various methods, and you can now take, with the information you've acquired, you can decide on what method you want to adopt.
All right, okay, we've been discussing some few reasons why contraceptive fails, and according to the doctor, according to a narration now, it shows that most of them are human errors, simple errors that we overlook, and I've been doing that with Dr. Tosin Laleye. It's still contraceptive matters. We'll take a short break now. When we return, we'll discuss more reasons. Please stay with us. right, thanks for staying with us. It's still Contraceptive Matters with DKT Nigeria, and today we are looking at reasons why contraceptives fail. So far, so good. We've been able to look at some of the reasons why they fail, and basically most of them are due to human errors, according to the doctor. And I'm sure viewers at home have one or two experiences to share with us. You can call 0908-729-6673, 0908-729-6673. Please share with us. We want to know if we have any other errors. Doctors, although the show is still on, we want to know if there are any other errors that you yourself noticed in the course of using a particular method. So, doctor, let's go ahead with some of the reasons.
All right, thank you very much. So initially I discussed 3 reasons. I'll just try to give a recap. Yes. The first one is if you don't follow instructions closely as to what time of the day you should use it. Another reason is if you ignore your doctor's appointment where checks are supposed to be conducted to make sure that the method is still in place. And okay, I'll see if you were listening to me. What was the third one?
The third one was mishandling.
Yes, where I talked about the condom. Thank you very much. So I go on to the 4th method now, which is improper usage. Sometimes contraceptive methods fail when they are not used properly. And the culprit in this, under this particular reason is the diaphragm. That's the kaya. Now, you know, when we're talking about the diaphragm, we said that the woman will need to go, if you have chosen to use this particular method, the healthcare professional will need to teach you how to properly insert the diaphragm. And you insert it such that it covers the cervix completely. If you don't insert it properly, if it's not covering the cervix completely, that means part of the spermatozoa will still be able to find their way in to fertilize the egg. So for you to ensure maximum effectivity with this method, you need to learn how to insert it properly, and you can actually practice, have repeated practice before you actually use it, as in before you engage in sexual interaction. Make sure you've practiced.
Because you are not even sure if it's fixed, if it was fixed properly. What if you have a backup plan?
Well,
is that allowed?
What backup plan do you want to use?
Like maybe an emergency contraceptive pill.
Well, there's really no need for that, because this method on its own, the only thing is you need to learn to fix it properly. And that's why you have the healthcare professional. Have them teach you. Do it while you are still there with them. Do it repeatedly. Like they say, practice makes perfect. It may be awkward the first few times you try it, but I believe that it is not so hard, because research actually shows that 80% of women were actually able to insert it properly the first time by just following the instructions on the pack. That is without having somebody teach them. 80% of women were able to get it right. So if you feel that it may be difficult for you to get it right, especially as a first-timer, all you need to do is just to make sure that you have someone teach you and have regular practice before you start to use the method proper. So to avoid any errors with the diaphragm, you need to insert it properly to cover the cervix entirely. And then another...
So before you move to the next reason, please call 0908-729-6673, 0908-729-6673. But please, the rule is lower the volume of your TV set. Lower the volume of your TV set, and please gather your thoughts, because we have lots of people. I'm sure we have lots of people trying to call in at the same time. So please lower the volume of your TV set and gather your thoughts before you get through. Okay, doctor?
Thank you very much. So the next point I'll be talking about is certain chronic health conditions. For example, some women have conditions like chronic diarrhea and vomiting for whatsoever reason. And then most of the time, people with this kind of chronic conditions actually eventually have a problem with absorption. Absorption is the process of whatever you take into your stomach, of it being absorbed into the blood system. So if you are the kind of woman who has problem with chronic diarrhea and vomiting, there is most likely to be a problem with absorption. So if you are on the daily pill, for example, it may not be absorbed, and if it is not absorbed, it cannot perform the health, what it cannot perform the function it is supposed to perform, and that's the function of preventing unwanted pregnancy. So that is why it is important for you to see your healthcare professional, and when they are trying to take your history, it's important you do not hide anything from your doctor. Okay. Tell it like it is. Tell them everything so that they can be in a better position to advise on what method is best for you.
Hello, good afternoon. Hello, good afternoon. Hello, good afternoon. Welcome to Contraceptive Matters. Hello. Your name is Wasiu. Did I get you right? From Ishagam. Wasiu. Hello, are you there? Oh, I think we lost Wasiu. Please call back. Call 0908-729-6673. Hello, good afternoon. Hello. Hello. Okay, the program is still Contraceptive Matters with DKT Nigeria, made possible by DKT Nigeria, one of the largest and private providers of contraceptive and reproductive health products in the country. And basically what we do on this show is to encourage women, sexually active persons, adopt healthy and smart choices when it comes to child spacing method, thereby reducing maternal mortality rates and sexually transmitted diseases in the community. Hello, good afternoon. Hello? Hello, are you there? All right, today we've been talking reasons. We're looking at some reasons contraceptive fail, and I have been doing that with Dr. Tosin Laleye. Okay, let's move ahead.
Okay, I hope the calls will eventually come in.
Okay.
Okay, the next reason why, okay, do we have a call?
Hello, good afternoon. Hello? Hello, good afternoon. Why? All right. So.
Okay, so the next reason.
Hello, good afternoon. Please speak up a little bit. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Welcome to Contraceptive Matters. What's your name?
My name is Adekaya Oluwatomiwa.
Oluwatomiwa. Where are you calling from, Oluwatomiwa?
I'm calling from Igbogo.
You're calling from? Igbogo. Thanks for calling. What's your question?
I want to ask one question.
Okay.
If one person has diabetes and want to collect this.
If you are diabetic, you want to know if you can adopt any of this method. Did I get you right?
Yes.
Okay. Thank you, Oluwatomiwa. Okay.
All right. Her question is actually very, very timely, related to the next thing I was about to say. I was going to talk next about drug interactions. Okay. That there are actually some drugs that interact with the pill now, for example, because that is the one you take by mouth, orally. Okay. So, like she asked, some anti-diabetic drugs actually may cross-react with the daily pill and render it ineffective. So for you, as a diabetic patient or any other person out there, it may not be advised that you adopt the daily pill as your preferred method. But that doesn't mean that there aren't other methods that you can use. You can use virtually all the other methods. The only one that is not recommended is this daily pill because of the nature of how it is ingested and all of that.
Hello, good afternoon.
Hello, good afternoon.
Hello, good afternoon. Welcome to Contraceptive Matters. What's your name? Hello? Hello, are you there? Wow, we lost that call. Please call 0908-729-6673. 0908-729-6673. Hello, good afternoon. Hello? Hello? Hello, good afternoon. Okay, doctor, let's forge ahead.
So I was talking about drugs that may cross-react with the contraceptives, basically the oral pill now. So I've mentioned anti-diabetic drugs, and then we also have some individuals on drugs for depression, so which we refer to as antidepressants. Okay. So antidepressants can also cross-react and may not make the drugs as effective as they should be. And then we also have some antifungals, which are used to treat fungal infections. And what happens is that most of the time, once you disclose to your doctor that you're on antifungals, if for any reason you must take the daily pill, then you may need to take a higher dose than required because of the effect of these drugs.
Hello, good afternoon. Good afternoon, ma. Where are you calling from? What's your name?
My name is Mrs. Ibrahim
Mrs. Ibrahim, where are you calling from?
from my 12.
My 12. Thanks for calling. What's your question?
Please, my question is that what someone has an infertility problem,
Okay.
and I went to the hospital, but after the scan, they said maybe one of my fallopian tube is not opened,
Okay.
and the doctor gave me treatment. For
Okay.
3 years.
For 3 years. Did you say 3 years?
No, I said till now I've not taken. That is what I'm trying to do.
For how long?
And last year, yeah.
Okay. So,
Okay, but are you still on treatment or you've stopped your treatment?
You said what?
Are you still on treatment? Are you still seeing the doctor?
No, I have stopped the treatment. The treatment is over since last 2 months now.
Okay, the doctor told you the treatment is over, and what did he tell you to do?
The first time I went there after the scan, he said one of the fallopian tubes one is open, the other one is not open. Then he started treatment with I collected some injection, and then he gave me some drugs that time. But the medicine has finished now.
Okay, did you go back after the medicines finished?
No, I've not go back.
Please go back. Go back, please. Do you
it's a
understand?
continuous process.
Yes. And it is only, and then have you been seeing a gynecologist?
I went to some college, but there's one drug that they gave us.
No. I want to
Is the
know.
doctor a
I want to know if you've been
gynecologist?
seeing a specialist, a gynecologist.
Hello, Mrs. Ibrahim.
Okay, you can just listen to us. I will just try to shed more light on that. For cases of infertility, there are not cases whereby, for example, like malaria, you go to the hospital, they give you anti-malarials, and then you go home, you take them, you're done taking them, and then that is it.
That's all.
For treatment of infertility, most of the time, the treatment is continuous up until the time you actually finally take it. And for a lot of these women, even after they take in, some of them still need to take certain medications, depending on what was responsible for the infertility in the first place. So, Mrs. Ibrahim, I would like to advise that you please go back to your doctor. The fact that the medications he gave you have been exhausted doesn't mean that your treatment is over. And since he initially did a scan and saw that one of the tubes was blocked, he placed you on medications. There may be a need to actually check again after treating you to see if there has been any change or if you will need to do one or two other things. So please, it is very important to see your doctor, and I believe you've been seeing a gynecologist. If not, you need to see a gynecologist.
Hello, good morning.
Good morning, ma.
Good morning, ma. Where are you calling from? What's your name?
I'm calling from Ikorodu.
Okay, what's your name?
My name is Esther.
Esther from Ikorodu. Hello, little Esther. So what's your question?
My question is, I've been on medication, like injection,
Okay.
but yet I've not been able to free my menstruation.
We didn't get that.
Okay, you've been on the injectable contraceptive.
Yes, ma.
Okay, for how long?
So like 2 months ago.
Okay, and you've not seen your period since then?
Yes, ma. Whenever I take the injection, it always take me like some months after before seeing my menstruation.
Okay,
Is that all, Esther?
But for like 2 months now,
you've not seen it.
I've not been able to see my menstruation.
Okay, but you started the injectables 2 months ago.
No, I started like immediately after the death of my second child.
Okay.
Like,
Okay, but you
after
took the last dose 2 months ago?
Yes, ma. You
Okay.
get that.
And has
Alright.
it always been like this?
Yes.
Okay. Thank you so much, Esther.
Okay. The thing about it is that for the injectable, the major side effect, the most things that women complain about is that they don't see their period. For some, it will initially be irregular, and then for some, they might not even see it at all. So Esther, you don't need to worry. It is perfectly normal with the method you are on. You're not likely to see your period, and if at all you see it, it will be reduced, very, very much reduced. But it's not like bad blood is being stored up inside you somewhere. So you can relax. You don't need to worry.
Okay, so let's round up on the reasons before we receive more call.
Okay, so I talked about drug interactions, various drugs, and then some lifestyle habits like smoking, for example. Smoking, research has shown that smoking can actually affect the efficacy of the daily pill. So as a woman, if you are on the daily pill, you might want to give up smoking of cigarette. Okay. And then apart from it rendering it inefficacious like it should be, smoking may also interact with some other components of the contraceptive pill and may predispose the woman to conditions like high blood pressure and all of that. So if you're a woman and you're on the daily pill, you might want to give up smoking of cigarettes. And then finally, as of the points I will,
antibiotics?
Well, yeah, under the
drug
interactions, yes, certain antibiotics, antifungals, antidiabetics can also be a culprit. So that is why it's important to discuss with your doctor if you are on any medication before you adopt this method, so they can advise you as to the appropriate method for you. And then
please hold your thought. I think we have a call. Hello, good afternoon. Hello. Hello, good afternoon.
Good afternoon, ma.
Can you please speak up? We can hardly hear what you're saying.
Hello, good afternoon, ma.
Good afternoon.
Hello, good afternoon, ma.
This is Neka from Japan.
You need
We
to speak
can't
up.
hear you. You need to speak up. Are you still in bed? Hello? I'm afraid we have to let you go, or you call back. We can hardly hear what you're saying. All right. So, doctor.
Yeah, on a final note as to some of the reasons that we're discussing, the final one is similar to the last one I discussed anyway, that's drug interaction. So this one talks about interaction with herbal medications or herbal concoctions. This is Nigeria. We take a lot of herbal mixtures, a lot of them we have no idea.
Because we are Africans.
Yeah, we are Africans. But let us also remember that these contraceptive pills are not our thing. So we need to put into consideration that once you are, especially the daily pill now, and then if you are on it and then you take a lot of herbal concoctions, some natural pills, even the popularly known garlic pills, because there are people who take that every day. That has also been implicated as interacting with this method to make it ineffective. So if you're a woman, you are on this particular method, that's the pill now, you might want to cut down on some of these herbal mixtures so that it does not render your contraceptive inefficacious, so that you don't complain that, oh, I'm on this method, yet I got pregnant, what went wrong, and all of that.
Okay, hello, good afternoon. Hello.
Hello, good afternoon.
Hello, good afternoon. Welcome to Contraceptive Matters.
Yeah, this is Lizzie calling from Ikorodu.
Lizzie from Ikorodu, you're welcome. Thanks for calling.
Please, I want to ask the doctor a question.
Okay, go ahead.
Any woman using pills and at a time within a period of 5 to 6 months, the message should be dropping once in a day instead of 3 or 4 days.
Okay.
Is there any problem about that?
Okay, is that all, Lizzie?
Yes.
Okay, thank you so much, Lizzie. Hello, good afternoon. Hello, good afternoon. Okay, I think we lost the other call. Okay.
All right. Lizzie, thank you very much for your question. Well, for the daily pill, like I explained before, the injectable is the one that is really a major culprit when it comes to the menses dropping or not even showing up at all. But the daily pill is also an example of a hormonal method. And most of these hormonal methods actually can affect the menstrual flow. So there is no reason, if your flow is not coming as you usually see it, there's really no problem. Most of these hormonal methods, of which the daily pill is an example, will affect your flow, your monthly flow. So you don't need to worry. There's no bad blood being stored up anywhere. You can relax. There's no problem.
Okay, it's still Contraceptive Matters with DKT Nigeria, and today we are looking at some of the reasons why contraceptives fail, and we've tried to look at some of them. It could be your health condition, it could be as a result of drug interactions, it could be mishandling of any product, especially the dual method, which is the barrier method. It could be as a result of neglecting the doctor's directive. Okay, if you have 1 or 2 questions to ask the doctor before the show's end, call 0908 729 6673, 0908 729 6673, or log on to www.honeyandbanana.com, log on to www.honeyandbanana.com, or send your messages to DKT's toll-free short code. That's by typing RHS space your question to 38350 from your phone. Type RHS space your question to 38350. After typing RHS space your question to 38350. We'll take a short break now. When we return, we take more calls. Please stay with us. All right, thanks for staying with us. It's still Contraceptive Matters with DKT Nigeria, made possible by one of the largest and private providers of contraceptives and reproductive health products in the country. And we've been discussing reasons why contraceptives fail with Dr. Tosin Laleye. Okay, doctor, before we went on the break, we received some calls. Hello, good afternoon. Good afternoon, ma. Where are you calling from? Igbobo, okay. What's your name?
Yes. Please, I want to ask a question, please. My name is Shola.
Your name is Shola?
Yes.
Okay, what's your question?
Please, I want to ask a question, sir. What about if somebody has, when he or she, when she
Can
went
you
to your
please slow down, Shola? Shola?
when you're saying she has,
Hello, Shola, can you hear us?
Meaning.
Hello, Shola?
That the person has meaning.
Shola,
Yes.
please lower the volume of your TV set, then slow down. You're on here already. Lower the volume of your TV set and slow down, please. Hello, Shola, are you still there?
I'm there.
Okay. I can still hear your TV. The volume of your TV is still high. I'm afraid we have to let you go. Okay.
Okay, so one very, very, very important reason why the contraceptive may also fail is the fact that it is expired. So, and the thing about it is that for the methods that, for this to occur, it most of the time will only occur with the emergency pill or the condom, because those are the ones you buy over the counter. Okay. For the other ones you need a prescription for, there is no way you get an expired product from a health facility, because usually the health worker would have checked. Yes, they would have checked. So it's not likely to happen with most of the other methods. But with the condom, most of us might find it strange to hear that condoms can expire. Yes, they can expire. And when they are already expired, if you put them to use, they may tear, even in the presence of anything can happen once they are expired. So you need to check expiry dates before you buy. And if you are buying the emergency pill also, that's the post pill, you need to pay attention to the expiry dates. All right, doctor. So please, before we go, can you please share your final thoughts? Okay. So, well, on this topic, what I would just want to say is that for every method you have made up your mind to adopt, make sure that apart from, well, when you visit your health facility, make sure you ask a lot of questions. Go there, be fully armed with all the questions you want to find out answers to. So don't just adopt a method without knowing the nitty-gritty. Make sure that you find out as much as possible. Try to research on that method on your own. Try to find out as much information about it as much as possible, so that you can avoid doing the wrong things that you shouldn't be doing while on that method. And when you see your healthcare professional, ask problems. Ask questions. Ask questions, ask questions, ask questions. And as they educate you, as they answer your questions, make sure you put it into your memory. Do not forget what you're told, and try to use the contraceptive right for maximum results. Thank you very much. Ask questions and ask questions and do the right thing. By that, you get absolutely 100% efficiency. Yes. Okay, if you have one or two questions to ask, log on to www.oniandbanana.com. That's DKT's website. Log on to www.oniandbanana.com. You get more information about all the reproductive health products you need to find out about. And you can also send your message to DKT's toll-free shortcode by sending RHS, type space, and your question to 38350. Type RHS space, your question to 38350. Thank you so much for watching. I am Olasumbo Modupe. Bye-bye.